The United States of America is an outlier in the developed world. It has the highest healthcare costs for some of the lowest outcomes in amongst the wealthy nations. Since 1980, life expectancy has begun to go into reverse in America, um, and this is in large part due to the power of American monopoly capital in the healthcare markets and the product of neoliberalism. So, in today's podcast, I'll be speaking with John McDonagh, academic, recovering politician, and the author of America's Wrong Turn, a history and diagnosis of the problems caused by neoliberal economics and ideology in the field of American healthcare. Welcome again, everybody, to the Explaining History podcast, and I am very, very honoured today to be joined by John McDonagh, Professor of Practice in the Department of Health Policy and Management at the Harvard T.H. School of Public Health, which is really important that I kind of set out some credentials here because we're diving into a really complex area of debate around public health policy in the USA and the effect of neoliberalism on that. So we've got to really kind of set out our stall to begin with. John's here to talk today about his new book, America's Wrong Turn, US Healthcare in the Neoliberal Era. And so to begin with, welcome, John. It's a pleasure to have you today.
Thank you. It's an honor to be here, and congratulations on this fantastic podcast.
Well, thank you so much. Thank you so much. So, John, firstly, there's a huge amount to unpack talking about the effects of neoliberalism and privatization on healthcare in America. But firstly, let's just focus on the book for a moment. Tell me about the idea for the book. Where did it come from and the research? Tell us about that.
So I've had a checkered career. I was an actual practicing politician in Massachusetts, member of the House of Representatives for 13 years. Sometimes I call myself a politician in recovery. There's just certain parts of it you never get rid of. I spent time in academia. I ran the Massachusetts Consumer Health Advocacy Organization. I worked in the U.S. Senate on the writing and passage of Obamacare. And then I turned up at the Harvard School of Public Health to teach around 2011. Started teaching Masters of Public Health students, executive ed participants, more older folks, and talk about the U.S. healthcare system. And I would invariably show this one chart that is U.S. spending on medical care as a percent of our gross domestic product, and in comparison with 10 other leading advanced nations, including the UK, Germany, France, you can guess the rest.
Yeah.
And So teaching and showing that and looking at that level, but starting in 1980 and then going all the way up to 2010, 2015, 2020. Now it's up to 2025, of course. And one of the interesting things is that if you go back to the 1980 and you look at the chart, the U.S. was the highest spender as a proportion of our economy. And we were very much in the pack of 11 nations. We were there, but it was a tight pack. And then you look at it and you notice in the early 80s, around 82 and 83, something happened. And we just jackrabbited up away from the rest of the pack. And so since 1980, it's been up, and away. Some periods of leveling off in the 1990s and in the 20-teens. Mm-hmm. But for the most part, it's just a continuing gap. Every nation is growing. Every nation, including the UK, spends more on health, medical care services, but none come close to the U.S. So people would ask me when I show that slide, they say, what the heck happened to the U.S. in the 1980s? And quite honestly, I didn't have a clearly defined answer, and I started searching around about it, and it took a while, but eventually, after looking at all the alternatives, I came to the conclusion that it was the impact of the so-called neoliberal revolution that started big in the United States in the 70s and exploded in the 80s with the arrival of President Reagan, that had a demonstrable negative economic impact on health and medical care in the United States since the early 1980s and continues to this day, even though I'd say our neoliberal era has passed. Yeah. But the impact of it lives on and goes beyond the quote-unquote official era.
Because what you get in America, this explosion in the cost of healthcare, but that's not kind of matched by outstanding health outcomes either, is it?
Well, absolutely. And so, just because we have the highest spending isn't necessarily bad unto itself if in return for the highest spending we had the highest life expectancy, the lowest infant mortality, all measures that would be the highest standard globally. But in fact, if you look at the performance of the American system, our performance is substandard at every level, leading to all kinds of hypotheses about how it can happen and why. But one of the major hypotheses that I think a lot of people look at is that while the U.S. spends by far the most on hard medical costs, we actually spend the least on important social services like childcare, nutrition support, job training, those kind of affordable, better quality housing, things that actually have a lot more to do with how healthy the population is than just how much you spend on medical care to take care of people after they get sick.
Yeah. So, I mean, I think the way that the term here is public health, and public health education.
Yes.
And
public health, also in the U.S., we call it population health as well.
Right.
Both terms get used interchangeably.
Yes. And in terms of that, if you look at, say, France, the UK, Japan, equivalent wealthy nations, do they do particularly well on that sort of population health? Or is it a checkered picture?
Well is more of a judgmental term. What I can say quite confidently is they do better.
Yeah.
Far better than we do. So, for example, our Affordable Care Act, otherwise known as Obamacare, had a major positive impact in lowering the percent of Americans without health insurance. It went from about 18% had no health insurance down to, in the Biden years, around 7.5%. So a big advance. At the same time, it's important to understand that every other advanced nation, including the UK, covers 99 to 100% of their people. So we've had this big advance with Obamacare, but we are still at the bottom of the pack in terms of providing decent, affordable health insurance coverage to all of our citizens.
there was this. I'm going to quote something from Twitter, so I'm taking my life in my hands here. But some kind of MAGA type have a go at Europe kind of meme came out the other week, and it was when you look at the living standards in the UK, they're roughly equivalent to the poorest state in America, which I think is Missouri, I think perhaps, or Mississippi. It is.
Tends to show up at the bottom of the barrel most of the time.
And I was like, well, Britain has gone through 2 decades of lost economic growth due to austerity and other stupid policies. Too many to go into right now. But if you take from that fact that somebody living in London has, from the day they are born, in theory to the day they die, universal health care, they're going to be better off than somebody who doesn't have that in Mississippi. And so automatically living standards anywhere that have that they get an automatic boost. I didn't waste my time responding to the person on Twitter, but that's a fundamental thing to point out, is that you get people in perilous situations in America, which are to some people around the world kind of slightly incomprehensible. The idea that you would go to a hospital and present a credit card is just kind of a surreal proposition in the UK.
Well, and the other piece, of course, would be I would ask those people, I'd say, so you think that the UK is worse than the United States? How is it then that the United States has significantly lower life expectancy than the UK?
Yeah, I mean, and that
why? What explain? What then if the UK then is a really low level, the United States must be even lower, and in fact, it's true.
Well, I mean, and this is the ultimate arbiter of everything, isn't it? When you're looking at the one metric that truly matters above all else is, well, how long are you going to live, and how many years of wellness are you going to have in that time, on average? And obviously some countries do better than others. But in the case of America, I mean, the tragedy, a heartbreaking tragedy, is that it wasn't always as thus. There has been a downward trajectory. And this is the kind of, when we're talking about the neoliberal era, you can plot it on a graph.
Yes, absolutely.
Okay.
Right. It does. It's remarkable. And it's important to mention sort of most people in the U.S., when they hear about eras, they tend to think about the eras of single presidents. So there was the Barack Obama era. There was the John Kennedy era. There was the Richard Nixon era. And we tend to do that. There's a political scientist at Yale, Stephen Skowronek, who's come up with a different way of thinking about American politico-economic history with bigger eras involving multiple decades where there were dominant ideas and cultures in terms of how we acted with each other. And he identifies in the 250 years of the U.S., 5 political eras started by individual presidents. President Jefferson in the 1800s, Andrew Jackson around 1828, Abraham Lincoln in 1861, and then the last 2, Franklin Roosevelt, starting the New Deal Keynesian economic era in 1933 that went all the way up to 1980. And then that was succeeded in 1981 by a new era. Ronald Reagan was the initiator of a new era. Some people call it the free market era, or the supply side, or the Reagan era. And I find, and it gets confusing, but I find the term that is actually the most accurate to use is the neoliberal era. Because the people who were the intellectual forces behind this era, particularly an economist named Milton Friedman, very much his ideas formed out of the global neoliberal movement that organized itself in Switzerland on the shores of Lake Geneva in 1947 when they created the Mont Pelerin Society.
And found it actually came to Britain a year or 2 earlier in the guise of Margaret Thatcher.
Yes, it did. Absolutely. It also came a little earlier than in the United States because Friedrich Hayek, who was the original organizer, an economist from Austria, before he moved to the United States, he actually moved to London.
Yes.
And so he started doing some work there, and then he moved to the U.S., where he became very successful and well known in the 1940s. And Friedman eclipsed him. Friedman was a whole other level above him.
Yeah.
And he became the identification of this movement that Reagan was a full signed-on believer in, going way back to the 1950s and 60s.
And yeah, you have the people like Friedman, Hayek, von Mises, Ayn Rand, people like that. Throughout much of the post-war era, these are seen as people on the lunatic fringe. And there are, American New Dealers and British, in Great Britain, the kind of the centre ground of the Labour and the Conservative parties all said, oh yeah, but if you did those things, people would die in huge numbers. You can't possibly be serious. And there is a kind of, I was just reading Quinn Slobodian's amazing book, Hayek's Bastards, at the moment. And there is this undercurrent of almost, I don't want to kind of go down this rabbit hole too much, but it's sort of slightly eugenicist thought of, well, if lots of people do die, it's sort of, they're the bad ones anyway, and, who cares? Markets are for winners. But one of the things at the moment, I think, you said as well that kind of the neoliberal period's over, and I agree with you. We're in, I don't know what we're in now.
We don't know. It's in formation.
Yeah.
It's in formation, right? Absolutely.
Neo-feudalism, I think. But partly, I have this thought experiment. I thought, if you travel back to England in 1066 and you take William the Conqueror and you say, right, we're going to go forward in history, and we're going to go to the 21st century. So you take him here and he says, right, what's the valuable thing? And you say, well, back where you were, it was land. You ring fence the land and you charge the peasants rents, and that's what feudalism works at. But there's much more valuable stuff now. We invented modern medicine, and people are dependent on it, and people will pay almost anything, really, to have longer lives. And he would say to you, this time-travelling William the Conqueror, ring fence that. That's the valuable thing. And that's why sometimes I look at the status of things like the American healthcare system and its other monopolistic economic practices around the world, and I think, well, it is sort of a feudalism. Somebody has built a wall around health and is renting it back to you. And like the English peasant in the 11th century who can't do without land, we can't do without cancer drugs and diabetes drugs and all the other stuff. And that's my theory. What do you think, John?
Well, interesting parallel to that from today. One of the biggest manifestations of neoliberalism that lives today is called private equity financing.
Yeah.
Which is kind of capitalism on steroids, where a small group accumulates money and uses it to buy up companies, string them together, transform them, and then sell them off as quickly as possible.
Yeah.
And it's not about whatever they're happening to work on at a given point in time. That's just the process piece. It's really about the financialization of the economy. They're not after figuring out, can we create the best car ever? They're talking about how can we make the most amount of money in 5 to 7 years by extracting the value from these companies.
Yeah. And
when you talk about land, this has been very much true in healthcare and elsewhere. A private equity company will buy up a hospital, for example. And one of the things they will do early on to extract the value from that institution is they will sell the land and the buildings to an entity called a real estate investment trust, REIT, or a REIT. And so the private equity firm will sell the land and buildings from your hospital to a REIT, and the REIT will give the private equity firm a ton of money for the purchase. And from then on, the hospital itself is only a tenant on the land and in the building, and the hospital itself has to pay rent, very high rent, to the REIT forever. And so you've got the games going on in 1066.
Yeah.
And they're playing out today in terms of land, but this is piracy.
Well, I mean, this is
it's extraordinary, and this is very common in the U.S. right now. Very common.
And I think you have, I mean, the idea that there is a monolithic thing called capitalism. There are capitalisms. Danish capitalism is not the same as American capitalism, is not the same as Chinese capitalism. There are different iterations of it. And you have some capitalisms historically. I mean, if you take about America's capitalism in World War II, they created the manufacturing base to create 100,000 aircraft. Or from the Reagan moment, not necessarily beginning with Reagan, it began probably before that, but you have this move towards rent extraction.
Yes.
And therefore, the kind of productive stuff that society needs, affordable homes, renewable energy, all the useful stuff, doesn't happen because there is no, the economic logic that we're told is, inviolable. That won't allow it because it doesn't fall to these series of kind of profit maximizing or profit gouging dictums. And so, I mean, what you've just given there, I think, is a really great example of, rent seeking and rent extraction. One of the things I think is observable about the American healthcare system and a great deal of the costs, and this is one of the paradoxes of neoliberalism, is it's insanely bureaucratic.
All of us strands are in real danger, and whatever it is, it's closing in. It started with just a few lost hairs here and there, but now more and more of us are disappearing every day. But listen, we think we have a plan. A way to stop the shedding. Pantene Abundant and Strong. Go now. It's not too late.
Pantene Abundant and Strong. It's a 3-step system that reduces hair loss by 85%. Only the strongest will survive the shedding.
And this is the thing we were told that neoliberalism was there to get rid of. Reagan said, government is the problem. It's all these pen pushers and people stamping forms. And that's a bit like the Soviet Union, and we don't like that. We're going to get rid of government and let markets decide. And markets are like magical, clever kind of spirits of the forest. They can just do things. But that's not the case, is it?
No, it isn't. And in fact, what we see is this kind of value extraction going on. So you're a hospital, you're bought up by private equity, you're no longer the owner of it. There's now a Wall Street firm that's in charge of your future, and they impose on you all different kinds of things that they have to do, like auditing you, providing consultants to you, and they make the hospital then pay through the nose for the services that they provide. So a lot of the profit to the private equity firm doesn't even come from the main value. It comes from all of the fees and assessments and other kinds of rents that they impose on the organizations that they buy up.
Yeah.
And it then hastens their demise and hastens their pathway to bankruptcy, as we've seen happen very often in the United States. And so that's a big part of the problem. Is the value extraction that goes on. That is the MO. And it goes back to our friend Milton Friedman, who in September 1970 wrote an op-ed in the Sunday New York Times. And the premise of the op-ed was that the only purpose of the for-profit corporation is maximum return of profits to shareholders,
Right.
and nothing else. Obligations to your customers or patients, to your workers, to your host communities, to the environment, hippiedom, socialism, communism, wrong. And so Friedman's op-ed became a mantra, and the mantra in the U.S. is called MSV, maximizing shareholder value, and that swept corporate America. It swept the business schools. That it was inevitable that the healthcare, medical care world in the United States would get swept up in this revolution, and it has transformed it, and it has transformed it in ways that Americans hate.
This brings me to a kind of I guess a final question really, is that Americans, as you say, it's not that there's this continent of people thinking this is a wonderful system and the pride of the world. People aren't stupid, are they? They know when they see their bank balances. They know when their healthcare claims are turned down. I mean, is there any hope for change, for meaningful change?
Yes, there's always hope.
Tell me. Let's talk about the hope, John.
I believe in feedback loops, positive feedback and negative feedback loops, and right now we're in a negative feedback loop in terms of American healthcare because people are focused on the harm, the injuries, the insanity, the extortion, but there are lots of seeds of hope for how we can get ourselves into a different track, a different loop where we gate off and fence off the private equity bandits who have been looting the system in so many ways. We have to confront in the United States this mass growth of monopoly and corporate concentration that was part of the neoliberal playbook.
Yeah.
We used to be really tough in the United States on antitrust.
Teddy Roosevelt.
We were, and the neoliberals in the 1970s, led by a guy by the name of Robert Bork, B-O-R-K, who was a failed Supreme Court justice nominee by Reagan, basically said, the notion that big is bad is wrong, and that we need to come up with a new standard for antitrust. And the new standard should be, if a merger will create lower prices for anybody, then it should get a green light and be able to go forward. And that belief actually captured the nation during the Reagan years, and the whole system kind of went into, like a bear going into a cave for hibernation. Antitrust became a shadow of its former self. And there's lots of economists today, some of the younger, smarter, savvier crowd who aren't so ideologically bound to the old system, who say, if you really want to understand why the costs of U.S. healthcare are so big today, it begins with corporate monopoly.
Yeah.
We have allowed this massive concentration of hospitals, physician practices, insurance companies, drug companies, across the whole spectrum, even dialysis providers, the United States, right? 90% of the dialysis care in the United States is provided by only 2 companies. And it didn't used to be that way, but that's what happens when you turn off the switch and let corporate concentration go forward on autopilot, and this is what we've got. So there are lots of things that we can do, and there's a lot of exciting, interesting work going on right now across the United States from groups working at the local, the state, and the national level to turn things around. So I am an optimist. It'll take a few years. We've got to get rid of this corrupt regime that is running our federal government right now, and I use that word corrupt advisedly. It's not just a throwaway line. They are corrupt in a way we've never seen before. We've got to get rid of them.
They're not really embarrassed about it. They don't try to keep it quiet, really, do they?
Again, never seen anything like it. But so there'll be a new administration coming in January 2029, and I think it's going to be an administration that's been guided by public revulsion of what they see going on today in the United States.
I think the final thought is when you try to think about, I mean, scholars and philosophers and intellectuals debate this one constantly, but what is capitalism? A popular answer is, well, capitalism is competition. It's markets. It's the small businesses. It's that kind of thing. And you see, I don't think it is. I think what you're describing there is commerce. People trading that they've always done for, time immemorial. What capitalism actually is the rule of capital. It's capital being in charge of things, and governments shying away or colluding and giving capital the power to kind of do what it wants. And in that sense, what you're seeing here is the rawest form of capitalism. But in the way that most people see it, most pretty decent folks see it, they see this kind of monopolization of the economy and say, well, that's not capitalism. That's just, well, kind of, again, coming back to this word of feudalism. And, depending on who you ask, you get a different answer. But I think that there's something valuable in looking at the way that monopolies operate and say, well, is that consistent with what we were always told should happen?
Well, there is a term for that. And the term, not surprisingly, is called monopoly capitalism.
Yeah.
And that's what we're living with in the United States right now. It's interesting. The neoliberals, in their initial ideas and thinking in the 1930s and 40s and 50s, looked back to Great Britain in the 18th century to Adam Smith, who created the metaphor of the invisible hand, who recognized self-interest as a driving force. And the neoliberals cheered him and said, we want to restore Adam Smith's vision of the world. But what they conveniently ignored was that Adam Smith, while he was a proponent of capitalism, also believed in regulated capitalism.
Yeah, there's a whole bunch of stuff he would be saying today.
He particularly emphasized you can never take your eyes off the banks.
Yeah.
You always have to keep them under tough regulation. He also supported taxes on things that he thought harmed society, like alcohol and smoking and things like that. But so they took their idealized conservative view of Adam Smith, and he became their icon for their first decades, not understanding that, it's not. And one of the things that is it's annoying about the neoliberals is that they present everything in black and white. That you either have economic freedom and or you don't, and you only have equality. And they create these dualisms that aren't just true in the real world. So yeah, there's capitalism and there's socialism, but there's all different kinds of socialism, and there's all different kinds of capitalism.
Well, there's this
notion that it's all or nothing one way is just naive and is disturbing that intellects of their power would so fall into this black and white nonsense.
Well, I presume some of them don't believe it for a moment. I mean, when you have, again, on the kind of the neoliberal right, very kind of right-wing American commentators saying, the NHS, do you know who else had something like that? Stalin, that's who. And it's like, yeah, no, well, not really. I mean, in no way are they comparable. Other than that, brilliant argument. Yes, well done.
It was a fake line in the 1940s and 50s that when the communists take over, the first thing they do is socialize the healthcare system. And so they point then to the UK as their example of that. And there's no evidence. It was just a political slogan dressed up as a theory that had no relevance to the real world.
Yeah. Well, firstly, it's been a huge pleasure to talk with you today, John. Really, really revealing. And I guess this is mainly for American listeners, but if you're in the US, you've listened to this and you want to be involved in being part of the solution, what can you do?
Well, so what I'm attempting to do, most Americans are very upset about our healthcare system, and they see all of these things that really annoy them: the high cost of premiums, the cost sharing, the monopoly, private equity, all these things, and they see them as discrete and separate. And my message is they all fit together because they all have their roots and their beginnings in the neoliberal revolution of the 60s and 70s and 80s. And if you don't know how we got to where we are, it's a lot harder than to think about how do we fix it. President Harry Truman had a saying. He said, the only thing you don't know is the history you haven't read. And so, for example, there's been a ton of books about neoliberalism in the United States and elsewhere. This, I believe, is the first book that looks at the impact of neoliberalism on the U.S. health and medical care system. And that was the gap that I saw that I was trying to fill in this book.
Brilliant, brilliant. So get the book, and let's just give it a very brief plug. So again, it's America's Wrong Turn, U.S. Healthcare in the Neoliberal Era by John McDonagh. Currently available in all good bookshops?
It's a university press, so
Yep.
It's hit or miss. So the easy way people do it is Amazon. But here's the thing. If you go to the Johns Hopkins University Press website, and you remember just 4 letters, HTWN, you get 30% off the price.
Right. I'll put that on the blog post.
Thank you.
As we always say on this podcast, please get it from the university press. They are not the gigantic. We can't talk about health monopolies for like 30 minutes and then like plug a retail monopoly. So get it from the university press, please do, or an independent retailer, and I'll put the code. Let me just write that down. What was the 4 letters again?
HTWN.
HTWN. Right. Okay. Because that will shave a chunk off the price.
Absolutely.
And I'll host this on the blog later on. John, it was a delight to talk to you today.
Very great.
I would love to talk about neoliberalism further if you ever have the time.
Anytime. Come and get me.
Okay. All right.
Thanks a lot.
Best luck
Take
with
care.
the book. Take care now.
Yep.
Bye-bye.
Bye-bye. Okay.
Thank you for listening to this episode of Explaining History. This podcast is an independent production, and it's listener support that keeps these conversations going week after week. If you find value in the show and want to help cover the costs of research and production, please consider making a contribution. You can join our community on Patreon or make a one-off donation. Just follow the links in the show notes for this episode. Every bit of support is truly appreciated. Thanks again for listening.